Bismillahirrahmanirrahim. Dear students, in the communicable diseases, now we are going to discuss surface infections. And today we will discuss tetanus. In Urdu, tetanus is known as tashannud. In this lecture, we will briefly describe the problem statement, what are the epidemiological determinants, then we will discuss the types of tetanus and the clinical features, how will you diagnose a case of tetanus, and what are the preventive and control measures of tetanus. Problem statement. Tetanus is now comparatively a rare disease in the developed countries. Neonatal tetanus is a killer disease, and even with the treatment, the case fatality rate can be as high as 80 to 90%. Tetanus tends to occur in areas with poor access to healthcare services. Because of the low notification efficiency, WHO makes estimates of the annual neonatal morbidity and mortality because of tetanus. And according to an estimate by WHO, during the year 2012, a total of 10,392 cases of tetanus occurred worldwide, and 4,650 cases of neonatal tetanus occurred during the same year, according to WHO. Tetanus is an acute disease induced by the exotoxin of Clostridium tetani, and clinically it is characterized by muscular rigidity, which persists throughout the illness and which is punctuated by painful paroxysmal spasm of voluntary muscles, especially the masseters, which gives a characteristic appearance known as lockjaw, the facial muscles known as rhizus sardonicus, the muscles of the back and neck, and those of the lower limb and abdomen. The mortality tends to be very high, varying from 40 to 80%. Now we will discuss the epidemiological determinants of tetanus. First of all, agent factors. Tetanus is caused by Clostridium tetani, which is a gram-positive anaerobic spore-bearing organism. These spores, they are highly resistant to boiling, phenol, cresol, and autoclaving for 15 minutes at 120 centigrade. However, these spores, they are best destroyed by steam under pressure at 120 centigrade for 20 minutes or by exposure to gamma radiation. Reservoir of infection. The natural habitat of the organism is soil and dust. The spores, they survive for years in the nature. The bacilli, however, they are also found in the intestine of many herbivorous animals, for example, cattle, horses, goats, and sheep, and they are excreted in their feces. These bacilli may also be found frequently in the intestine of the man without causing any ill effects. Clostridium tetani produces an exotoxin, and that exotoxin has an astounding lethal activity which is only exceeded by botulinum toxin. The lethal dose for a 70 kg man is about 0.1 milligram. The exotoxin acts on the four areas of the nervous system, which are the motor end plates in the skeletal system, the spinal cord, the brain, and the sympathetic system. Its principal action is to block the inhibition of the spinal reflexes. Period of communicability. It is none because it is not transmitted from person to person. Now we will discuss the host factors. First of all, age. Tetanus is commonly a disease of active age groups, that is, in the age groups between 5 to 40 years, because this is the age when a person is exposed to all kinds of trauma, and therefore the risk of acquiring the disease during this age group is high. Occurrence of tetanus in infants is known as neonatal tetanus. In it, infants get tetanus when the infants are delivered in non-septic conditions. The incidence is higher when the umbilical cord is cut with unsterile instruments or when the umbilical stump is dressed with soil or ashes. Sex. Males appear to be more sensitive to tetanus than females, and a higher incidence of this disease is found in males. Occupation. Agricultural workers, they are at special risk because of their frequent contact with soil. Host factors. Rural and urban differences. The incidence of tetanus is much lower in the urban areas than in the rural areas. And also in the urban areas, there may be variations. For example, in the outskirts of the city where the animals live close to human beings, the incidence of this disease may be more than compared to the towns which are in the center of the city. Immunity. No age is immune unless protected by previous immunization. The immunity resulting from 2 injections of tetanus toxoid is effective and it lasts for several years. Tetanus is one of the diseases in which herd immunity does not protect the individual. Disease tetanus is a positive environmental hazard. Its occurrence depends upon man's physical and ecological surroundings. The environmental factors, they are further compounded by the social factors, such as unhygienic customs and habits. For example, application of dust or animal dung to wounds, unhygienic delivery practices which leads to neonatal tetanus. For example, using unsterilized instruments for cutting the cord, umbilical cord, ignorance of infection, and lack of primary healthcare services. In industrialized developed countries, urbanization and mechanization of agriculture, it has interfered with the normal process of distribution of Clostridium tetanus and thus have reduced the morbidity rate in developed countries. Now we will discuss the mode of transmission of tetanus. Infection is acquired by contamination of wounds with tetanus spores. The range of injuries and accidents which may lead to tetanus, they comprise a minor trivial pinprick, skin abrasion, puncture wounds, burns, human bites, animal bites, and stings, unsterile surgery, intrauterine death, bowel surgery, dental extracts, injections, unsterile division of umbilical cord, which leads to neonatal tetanus, compound fractures, otitis media, chronic skin ulcers, eye infections, and gangrenous limbs. All of these may lead to tetanus. However, the sequence of events they include first the introduction of spores, then the germination and elaboration of the exotoxin, and finally binding of the exotoxin to the receptor sites. The incubation period of this disease may be as short as 1 day, or it may be as long as several months, but the usual incubation period is 6 to 10 days. The long incubation period is explained by the spores, which are lying dormant in the wounds, and incubation period may also be prolonged by prophylaxis. There are 5 different types of tetanus. Tetanus may be traumatic, puerperal, autogenic, idiopathic, and tetanus neonatorum. Traumatic trauma is a major and important cause of tetanus, and sometimes even a minor injury or unnoticed wounds may lead to tetanus. Puerperal tetanus follows abortion more frequently than a normal labor. A post-abortal uterus is basically more favorable site for the germination of tetanus spores. Autogenic, although it is a rare one. Ears may be a rare portal of entry. Foreign bodies such as infected pencils, matches, and beads may introduce the infection. Idiopathic, sometimes no definitive history of an injury can be found. It may be the result of some microscopic trauma, or it may be due to the absorption of tetanus toxins from the intestinal tract, or maybe because of tetanus spores inhaled and start the infection. Tetanus neonatorum. In many countries, neonatal tetanus kills about 85% of those afflicted. The common cause is the infection of the umbilical stem after birth, which occurs either because of the unsterile environment in which the delivery was performed, or the blade which was used to cut the umbilical cord was not sterile. The first symptom being seen is about the seventh day. Therefore, tetanus is also known as eighth-day disease. In any country where the hygiene is poor, neonatal tetanus may be common. Common signs and symptoms of tetanus include spasm and stiffness in the jaw muscles, also known as trismus, stiffness of the neck muscles, difficulty in swallowing, stiffness of abdominal muscles, painful body spasms lasting for several minutes, and which are typically triggered by minor occurrences such as a loud noise, physical touch, or light. In addition, there may be fever, sweating, elevated blood pressure, and rapid heart rate. This picture is showing you the typical painful spasm of the muscles of the back, and which leads to a typical appearance which is known as opisthotonus. Now we will discuss the prevention of tetanus. First we will discuss the active immunization. Tetanus is best prevented by active immunization with tetanus toxoid. It stimulates the production of protective antitoxin. The aim of active immunization should be to vaccinate the entire community. All the persons should be immunized regardless of their age. There are two preparations available for active immunization. Combined vaccine, which may be a trivalent vaccine, that is diphtheria, pertussis, tetanus, DPT, or pentavalent vaccines, which contains 5 vaccines. This is included in the EPI schedule, and it is given to infants at the age of 6 weeks, 10 weeks, and 14 weeks of age. And the next is monovalent vaccines. Monovalent vaccines, there are of two types: plain or fluid toxoid vaccines, purified tetanus vaccines. Purified tetanus vaccines, they are preferred over the plain vaccines because they stimulate higher and longer lasting immunity when compared with plain toxoid vaccines. A primary course of immunization in case of monovalent vaccine consists of 2 doses of tetanus toxoid given at intervals of 1 to 2 months. Passive immunization. Temporary protection against tetanus can be provided by an injection of human tetanus hyperimmunoglobulin or antitoxin serum. Human tetanus hyperimmunoglobulin, it is the best prophylactic to use because it does not cause serum sickness. The dose for all age groups is 250 international units, and it gives a passive protection for up to 30 days. Anti-tetanus serum. The standard dose is 1500 international units injected subcutaneously after sensitivity testing. It gives protection, passive protection for about 7 to 10 days. Active and passive immunization. Simultaneous active and passive immunization is widely carried out in non-immune persons. In it, patient is given 1500 units of ATS or 250 units of human immunoglobulin in one arm and 0.5 ml of absorbed tetanus toxoid vaccine into the other arm or the gluteal region. Then this should be followed 6 weeks later by another dose of 0.5 ml of tetanus toxoid and a third dose 1 year later. The purpose of antitoxin is for immediate temporary protection and the purpose of toxoid is for long-lasting protection. Antibiotics, they are also indicated in prophylaxis against tetanus. Penicillin can be given, or if the person is allergic to penicillin, then the erythromycin can be given. They both kill the vegetative forms, but they don't kill the spores of the Clostridium tetanus. Prevention of neonatal tetanus. In unimmunized pregnant women, 2 doses of tetanus toxoid they should be given. The first dose should be given as early as possible during pregnancy, and the second dose should be given at least a month later and at least 3 weeks before the delivery time. These doses may be given between 16 to 36 weeks of pregnancy, thus allowing an interval of 1 to 2 months between the 2 doses. In the previously immunized pregnant woman, a booster dose is required. In areas where the incidence of neonatal tetanus is high, the primary 2-dose course can be extended to all women of childbearing age, particularly if the present coverage of antenatal care is low. In addition, appropriately training the traditional birth attendants and encouraging the 3 cleans, that is clean hands, clean delivery surface, and clean cord care. It has been shown that training the birth attendants alone can reduce the death rate due to neonatal tetanus by about 90%. This slide is showing you the recommendations for the prevention of tetanus in the wounded. All wounds they receive surgical, toilet, and then there are 2 types of wounds. First, the wounds which are less than 6 hours old, which are clean, non-penetrating, and with negligible tissue damage. Then depending upon the immunity category A, B, C, D, appropriate treatment is required. And the other wounds, again in the other category of wounds, depending upon the immunity status, immunity category of A, B, C, D, respective appropriate treatment is required. I request all the students to kindly go through this slide thoroughly. This concludes our today's lecture. Thank you very much.